During the evaluation process of a patient, we look at a record. In looking at those records, we take a look to see what the nasal cavity, the area behind the nose, and the pharynx looks like relative to the size of the tonsils and adenoids. Airway obstruction or blockages in the airway will contribute to a low tongue position. Patients who cannot breathe through their nose are forced to become obligate mouth breathers, and when that happens, they keep their tongue low so that the air can flow over the top of it. In keeping your tongue low, we need to recognize that the tongue is the thing that creates the width in our upper jaw. When there is chronic low tongue position, the width of the upper jaw becomes narrowed, and once it becomes narrowed, it's not going to typically return to being wider again unless an orthodontist goes in there and influences it. It's sort of a chicken and the egg scenario. Once that upper jaw becomes narrow, it also decreases the width of the nasal cavity, which further complicates the problem. So some patients, when they are sent out at a young age to have their tonsils and adenoids removed, may not get the full benefit of those tonsils and adenoids being removed because the nasal cavity and the resistance has not been brought back to the normal width again. So orthodontics in conjunction with those medical treatments oftentimes are necessary in order to get the most favorable outcomes.